it has a ripple effect throughout. So these are things. I think it's. I don't know. I just think everything is fascinating, what you all have been saying, because it has a ripple effect down to very specific decisions. Will I take that COVID vaccine or not? Right.
Mm-hmm.
Spirituality. We're talking about that too. I wanted to hear a little more. Tamara, you had brought that up about the spiritual side. So there's the side of fearful. I don't trust that you're going to do right by me. And that's an impediment to medical care and to hospice.
Mm-hmm. Mm-hmm.
There's also, and I've seen this myself, a reliance on the spirituality, which is actually a beautiful thing. And then in my prior podcast, we talked about, is it a hindrance or a blessing? And actually the chaplain there said both.
Mm.
And I thought that's probably something we should bring up, is the spirituality, because as you said, let's pray on it. Let's make it spiritual let's bring it back maybe to the factual matters of what's going on. Talk to me about that, because I'm enjoying listening to you all.
Well, I can talk as a chaplain, because here's some of the things that I hear from patients when we are talking, whether palliative care or whether we're talking hospice. And it goes back to not only, of course, the Tuskegee experiment, but the history of segregation in the healthcare system, where a black person will go to a hospital, and I'm sorry, we don't treat coloreds at this hospital. You go down to that hospital maybe 30 miles down the road. So even that era has to do with it, because it's about a denial of care, a feeling of helplessness, that you won't help me, that you are not willing to provide the best care for me. So when you are offering hospice, I'm thinking, my first question is, would you offer hospice to the white person? I mean, I've literally heard this. Would you offer hospice to the white man? And this is coming from a elderly black man who is thinking, this is yet another situation where you are denying me the best care. And in my mind, hospice is some dark, cold place over there where they play Amazing Grace in the background and just wait for you to die. Just give you morphine, because they always talking morphine in the hospice. So just sedate you until you die. So that's why a lot of times they're hesitant for a hospice. And because they're thinking, you are giving up on me. This is just the modern day era, you turning away the black person for care. So knowing that helps doctors nowadays, because now I know how to approach the patient. Just yesterday, when we were talking to a family, we knew they were very spiritual, and they prayed on everything. So guess what? We try to have the conversation as early as possible with prayer time in mind. So we know you need to pray about this, discuss it, it's your family. And when we were saying this, all the family was shaking their heads. So now we're not us versus you, it's us with you. We understand that God is important. We understand that we are not God and God is in control. So you're acknowledging their spirituality and say, we just want to give you the information so that you can know what to pray for and pray about, what decisions to make. So I think that's important to understand, that you don't set up an antagonistic David versus Goliath, Elijah versus the prophets of Baal. You don't set that situation up, but work with their spirituality, because as chaplains, we know that spirituality can help the patients through very difficult illnesses, and sometimes the treatment, chemo, can be terrible on somebody. So having a strong spirit is important. So we incorporate that in the care that we offer.
I wonder if also maybe reaching out within the community and leaving flyers and having conversations about what hospice looks like and the quality of care versus a place to go to die might make a difference as well. I think when it comes to the spiritual side of things, it's not only comforting to the individual who is being placed on hospice, but also the family. It gives a sense of peace. So I think that's important to remember.
I was thinking a little bit about spiritual. You said a lot of times it's a choice to pray on it. How do we reconcile? One of the big things that I struggle with, and I think you've seen this, Tamara, in our conversations with patients, is, and this is everyone, is there is just a flat-out denial of death. So then it takes on different forms in different communities for various reasons, and I think you've touched on some of those reasons collectively. How do we reconcile maintaining the spirituality for faith to get you through that, because you do need it, but also is there a denial of death, and how does that manifest? We've seen some aspects of that, but are you seeing that? Because I remember we had that conversation, personally you've seen that, where there's a lack of acknowledgement of decline, a lack of acknowledgement of what's going on. What do you all think about that?
Well, I actually recently went through a situation similar to that, as my aunt who helped raise me just recently passed away. And regardless of what the doctor was talking about, and she had a rare form of multiple myeloma that they could not control, and it was growing rapidly. And regardless of what the doctor explained to her, she just couldn't grasp, I'm dying. And I think that that's a natural response to anyone, regardless of what race or creed, to accept that kind of thing. And it takes a while. And we have to be patient and understand where that person is. And once again, as Tamara said, meet them where they are, instead of pushing our agenda onto them. As we begin to listen to them and help them deal with their fears and discomforts about what they're going through, because that's hard to take, then I think that they'll open up to us more.
I agree. And in addition to that, if they're a person of spirituality, reading verses, Bible verses, like Michael said, aligning with that spirituality. And sometimes it's just God's will. We don't know what his will is. He's the father of us all, and we, going to try to, handle things whatever God's will be. And so it kind of takes it out of our hand, out of hospice's hand, and places it in God's hands, saying, whatever his will be done.
Exactly.
And relying on those scriptures that give comfort, that allow the person to kind of process this as they need be, with that spirituality piece of it also helps.
That's very well said. So it's really about meeting people where they are in the moment, but still in the background of all this, starting to do more outreach and starting to explain what is hospice, what is mortality, and starting to do the educational push that has been lacking, and also going through the barriers of fear that have been there for very clear-cut reasons. They've been there now for decades and decades and decades, and generationally passed down. Breaking through that, it's kind of a twofold approach, saying, listen, we've got to do a better job of the educational portion. But then we still recognize, I agree with you, because actually I see that often. I do very much think that everyone has to just come to their acceptance at their own rate. Yes. And sometimes you get there and sometimes you don't. And, but I do believe also that the outreach portion can help facilitate that also. When you have good chaplaincy, when you have good spirituality, I believe that outreach portion can certainly pave the way to people coming to a better place of acceptance and letting down their guard.
And that's
also
even prior to them getting to that point.
Right.
So if we begin to educate the community ahead of time, then when they do have loved ones that are going on to hospice, they're more familiar, more aware of what that process looks like.
Yeah,
a lot of the directors who were trying to get the vaccine out, they started reaching out to a lot of pastors, and that's why a lot of vaccination shot sites were actually at churches, because I may not listen to you, but I trust my pastor.
Right.
So my pastor said it's okay. My pastor just got the vaccine. So again, that's working with their spirituality, and how we approached it when we had what we called a hyper-religious family, who they just had a scripture verse for everything. We often focused on wiggle room? Where can we get in? Where can we support you? Where can we help? And there's usually at least one answer for that. Well, just control my pain. Because once we build trust with them, then later on in their disease progression, when things started getting worse, they already had a relationship with us. They called us. I get a lot of calls at home on a Saturday because you're the only one, this literally they'll say, you're the only one who picks up the phone. So once we get that relationship with them, then I can connect them with the resources, because I always tell them, if I can't help you, I'll connect you with someone who can.
Right.
Because palliative care is about whole person care. Hospice is about whole person care.
That's right.
It's not just about morphine and a place to die. But let us get the whole team involved in helping you and your family. So getting that kind of education and outreach is, I think, very critical, because we always try to get that wiggle room before the crisis happens. So when the crisis happens, and we know it does, if this is a progressive disease, they already have a relationship with us.
It will happen, and I want you all to address, you mentioned morphine. Let's talk a little bit about the narcotic aspect of things. I have had families be resistant to that concept, and I think that's the unspoken problem there, because the truth is I need to medicate, and I'm actually a very judicious person when it comes to that, or I want to be. I mean, that's important to me. I don't think it's a good thing to over-medicate, but I think you need to control symptoms. What are the perceptions there? Are there perceptions, or are there not perceptions that you've encountered?
There are definitely perceptions.
Yeah.
Oh, yeah.
I can always rely on you just to
Oh, yeah.
say it as it is.
They,
Yes, we've encountered this.
Oh,
we've encountered
yes,
this. We've
they
encountered
want
this.
nothing to do with morphine. I've seen it on both ends of the spectrum. You have folks that want nothing to do with morphine. For whatever education that they've gotten about morphine, what it told them was that this is going to kill them off early. And they want nothing to do with that. Families, they're very close-minded about it. And it's trying to re-educate at that point. I'm not a doctor, I'm not a nurse, and so I rely on the clinical folk to give those the benefits of having the morphine. But I'm very vigilant when patients are resistant, families are resistant to it. I've also seen the adverse when it's like, okay, when can you start the morphine? Let's get that drip going, because people have this notion in their mind that morphine quickens the process.
I had one family that we started a drip on, and I remember distinctly that they called and said they want to stop it. They want to see if this is actually making things worse. And so we had a long conversation about that and talked it through, and then ultimately they made the decision to keep that in place, and it was actually a good thing. Mm-hmm. But I remember they were going through a lot of the struggles of, hey, is this really, again, the trust, is this really what needs to be put in place? Mm-hmm. Michael Dean, you're thinking things.
Oh, no, I'm just, we were, when you want to laugh in your head, but because, you're a compassionate professional. But several patients and families, they were worried about getting addicted. Mm-hmm. Mm-hmm. And I remember our doctor was saying, sir, the pain that you have is excruciating, and it's progressing so fast. And he didn't know how to say that you will die long before you become addicted. Mm-hmm. So this is the time to get it. But they were so worried about getting addicted that they were almost, it overshadowed the fact that they had very real pain, and this is the best thing that can help you. My experience, my mother was on hospice, and I didn't understand because they were telling me just give her a little drip of morphine and it will help her breathing, and I didn't understand that until I saw it in action, because she was breathing very heavily and very hard. and just a couple of drops under her tongue, and she was breathing so smoothly.
Exactly.
And I'm talking about within like 45 seconds. So that's when I became a big advocate, and I realized that, okay, this is actually designed to help when you use it as prescribed and use it with the medical supervision. It wasn't this thing that was going to hasten, but to give them a more quality passing, as opposed to, yes, you may pass anyway, but we don't want you to suffer.
Right.
Exactly.
So let us address the symptoms, and we always called it like a buffet. Whatever care is offered that you don't want or you don't think will help you, then just pass by. But let us present it all before you, because we think it will be the best way to have a quality of life. And even if your life ends earlier than you hope, we don't want you to leave this world suffering or in pain or distress.
Absolutely. And I'll also say this, from a clinical standpoint, there's a difference. Sometimes people get confused between tolerance and addiction. Addiction has some behavioral components to it. Tolerance is over time needing more and more medication to give you the same effect. You may become tolerant. Many of our patients are on high doses of medication. There's no addictive behavioral issues that I struggle with. That's one point to make. Another one is that I have a full amount of medications, you've seen this, to be able to give to patients. So, when they get worried about a medication, there are other options. And I loved what you mentioned, because as an educational push, I think it's important to say morphine is not just about pain. It's also about respiratory symptoms.
That's right.
It's about other aspects of controlling, or morphine and the family of morphine, I should say, the narcotic family. Jenny, I was going to ask you your opinion on the perceptions of narcotics, or if you thought that there was anything there also.
I do agree as well that the perceptions are negative. I think that a lot of times the individual may feel like you're just trying to dope me up. And I need to be able to stay in my right mind and function appropriately, because once again, they're still in that denial as well. And I'm going to beat this. I'm going to get better. I don't care what the doctors say. And
I've
sometimes,
prayed about it.
right,
The Lord's
I've prayed
gonna
about it, and
answer.
God told me
That's right.
that He's going to heal me.
That's right.
And I'm a faith-based woman myself, so I understand that faith, but I also think there's faith and there's reality.
Yeah.
And we have to begin to pair the two together.
And I share with people, while you are waiting on the Lord, let us help.
Right.
We can't rush God. If it was in our power, you would have been healed yesterday.
That's right.
But while we are praying for you, let us continue to offer you the best services that we can, and acknowledge what we cannot do. But let us help you in the areas where we can. So it's not like God says, "Oh, you got morphine? Well, you don't need me." I mean, it's not like God is a real stickler. It's me or nothing.
Right.
So I say,
It might actually be. I hate to interrupt. You're so funny. It might actually also be, just kind of putting it out there, that is manifestation of the Lord.
That's right.
Hospice, when well done, we are meant to die. All of us collectively, no matter what race, what creed, as you said. And I think that I'm trying so much to bring that message out, that is the common humanity there. When you start from that point and go backwards, everything becomes a little different. You start looking at people differently, and you think we're all on the same path. So the reason I mention that is, again, possibly hospice, when well done, in my mind, can be a manifestation of the spiritual. It's just that you have to have the education where you come to that point where you realize that that's actually true. And I fully am listening to what you all are saying about the baggage there, right, in coming to that educational point. And then also there's a leap of faith also with mortality. There's a leap of faith that I know that I'm destined for this, and I accept my fate. Now, if I'm given hospice and I'm given the means to try and control and manage things, perhaps that's part of the spiritual journey.
And using that time while on hospice to be able to get it right with God.
Oh, yes.
It's like a grace period. I've told families
That's beautiful.
that sometimes people pass away and they didn't get that time. A horrible car accident or something immediately happening where they didn't get that time. Hospice gives you that time. We know the time is drawing nigh, and you got that opportunity to get it right. And because we serve such a wonderful God, He just loves us.
Getting it right with God and getting it right with family.
I
And
was
getting
just
it
going to
right
say
with-
that.
Go ahead. I need your input
Because
on that.
oftentimes we have relationships that have been torn apart, and that gives you that opportunity to say, hey, let's work this out. When I was working in hospice, that was one of the things that I tried to work with our patients on and encourage. Let's mend these relationships.
And how wonderful it is to be a part of that process, going through it with
Yes.
families. And I tell folks, I wasn't here when all the drama was going on, but
That's
I'm here
right.
at the end when there's love and flourishing, and people were able to mend those.
Yes.
And there's no better feeling than that. being
Because that's
able
a major misconception about hospice, is that it's a place somewhere out there, when the overwhelming majority of hospice takes place in the patient's home.
That's right.
Or a place where they call home. So again, in the case of my mom, she got to the point she was so sick of going to the hospitals for them not to help me anyway.
Yeah.
She had that defiance and attitude. And I'll never forget the image when I took her to the hospital one last time. I said, Mom, we need to find out what's going on. Let me get a diagnosis so that I can get you set up with hospice. Because when they were pulling her out into the ambulance, out of the house, she was literally grabbing at the walls, saying, I don't want to go. So once I promised her that, Mom, once we find out what's going on with you, we can get you stabilized, and I promise I will bring you back home with hospice care. Then she stopped grabbing at the walls and let me take her to the hospital. So for her, hospice meant I can come home and I can stay home and I can die at home, because that's what's her wishes. So that's why I have a special place in my heart for hospice, because I know that it allowed my mom to pass with the dignity that she wanted, instead of being in a place, a hospital that she doesn't know anybody, everybody coming into her room and giving her treatment and telling them how much they can't do. She was able to have that peace, and we had quality time at home.
I think that's an important part, because once again, when they're able to receive hospice in their home, it is a difference than receiving it in a facility. As you said, people coming in, you don't know them. Once again, that fear comes in. What are they doing to me? Are they trying to kill me early? These are the things that we have to look at and what that looks like for them.
And for everybody, home is special. When you create that area of home, it's every expression of yourself. So being there to be able to let go, that's a pretty precious thing. I grieve for people who are in a hospital setting and that you have to withdraw care. Yeah. I think it's a very artificial, mechanized world, and I think it's painful to think that, they're not in a place of entirely comfort. They're being taken care of, but the home is a special place to pass. It's actually a privilege to be able to have that happen.
And I had a lot of patients, because they were homeowners. They may be the first homeowners in their generations of families, and they were so proud of their home and being homeowners that they wanted to die in their home. And that's the way my mom was. She owned a home. And she was very proud because you hear those statistics. There are not a lot of black homeowners. You would think in 2021 it would be so much difference, but they were just saying on the news about last week sometime about there's less black homeowners today than there was when they passed the Fair Housing Act. And everybody was like, wow, that's crazy. So there's a lot of people who still have that pride. So, I own this home. I want to die here. This is my place.
Yes.
So, encouraging people that, hey, we can get you home with the support of hospice. And they're not only there to support you, but to support your family. You told us, sir, that you don't want to be a burden. Well, help let the hospice team share that burden so that your family, your wife can focus on being your wife. Your daughter can focus on being your daughter. And we can bring in this support team to shoulder all the other responsibilities of caregiving for you.
I also think it's important, though, to allow them to control what they can control. Because when they've had everything taken from them, they can't control their health. They can't control what they eat because somebody else is cooking it for them. They can't control who helps them go to the bathroom or those things. It's important to give them something to hold on to.
I think we had a very comprehensive discussion today. Is there anything that we're missing? The point of this discussion was to get a conversation started about perceptions, maybe fears, lack of access to resources. You brought up incredible points about that. Insurance, the financial, and then perceptions of narcotics and spirituality. I just wanted to make sure, we left as much as, no stone unturned, and we said as much as we could in this segment. There's so much more to say.
Sure.
But will all of you give just a little parting thought on how, this whole point, as I said, was for outreach and to make sure that everybody collectively, no race or creed involved, knows about hospice and then particular issues to onboarding and getting people onto a hospice, the African American community. Any final thoughts?
Just for me, I would, like you said, as horrible as the pandemic was, as horrible as George Floyd was, it exposed so much. And even we had a national conference in the chaplains corps last week, and racism and how chaplains can help was at the center of it, primarily in response to George Floyd and the disparities that came out of the pandemic. So I just really appreciate the honest conversations because it was on video. How can you deny that now? There's still some are in denial. Right. We understand that. But there were so many allies and people working together. So many of us were heartbroken one day, but full of hope and encouragement the other day because people were finally listening and we were sitting down guilt-free as sisters and brothers, having a conversation and making a difference. And I think that seeing so many of our elderly blacks and whites sitting down getting vaccines because people respected them enough to listen to why are you having issues with it. Let's talk about it. Let's talk about what the vaccine is and how it came to be. You're scared that it came together so fast? Let me share with you why it was a lot faster than others in a way that makes sense. And people said, oh, okay, now that they talk to me, I'll do it. So I think just the channels of communications, I hope they never collapse because I think it's making an actual difference in our world.
This was a great conversation. I'm one to identify an issue or a problem and want to solve. And going forward from here, whether it be with my hospice patients or some of the other members that I serve through. I work with some of the Medicaid waivers and just education to patients and families and providing solutions to some of their problems that they're experiencing. Being open-minded and acknowledging their fears, their concerns. Sometimes we know as social workers it's just listening, just hearing, allowing them to be heard with the concerns, and providing that education with hopes to make the best decision it is for the family. And then myself being okay with, even if they don't choose what I think that they choose, be okay with the decision that the families and the patients have made. I do my part by educating and providing the information and the resources and allow the families to make the best decision for them. I'm glad, Dr. Bajari, that you see a need for this. I think we need more, that there needs to be more Caucasian allies that are open and acknowledging the issues and what needs to be, and then after the conversations, then going on to do something about it.
Yeah,
make,
absolutely.
Make some change.
Yeah.
Well, for my final thoughts, I would say that I also agree that the conversation has to be had. And I'm so glad that you decided to do this type of session. It's important that we begin to talk these things out and talk about what the needs are within the African American community. But I also believe it's also about continuing to do research within the African American community, talking to them to find out what their needs are, allowing them to have a voice in what they receive. Oftentimes we push our agendas and we push our thoughts of what they need. But doing those analysis is what's going to make the difference. I also think that outreaches such as these need to continue. We need to begin to not only go into the churches, but within the community centers, and let's have a conversation what this looks like. What do you think you need based on what we've provided, the information we've given you, and allowing people to have that voice.
Thank you. Thank you so much. I agree. Conversation is where it starts, and not shying away from conversation, and then just talking, honestly, is where things start. Thank you so much to all of you. I really appreciate it. Thank you for watching. Please like and share and subscribe, and we will post links below. And please give feedback on this podcast. Thank you again.